This is going to be a supine or lying on your back, short restorative yoga flow. So we're going to lie on your back with your knees bent. And let's start with your hands on either side of your rib cage. And I want to use them as feedback. So we're going to start with some breathing, and I want you to think about like you're expanding an umbrella. When you open the umbrella, that's your inhale. Your hands are going to push further apart. When you exhale, you're closing the umbrella, hands come back together, body sinks further into the ground. So envision that umbrella, or some people might say like bucket handle. I sometimes think jellyfish, whatever visualization works for you. So your hands are going to rest gently on the lower outer parts of your rib cage. We'll inhale and exhale. And keeping in mind as you keep breathing, think about slowly starting to deepen your breath rather than starting off with forced bigger breaths. If your first couple are shallower or a shorter count, that is okay. And then if you can try to start to expand the length of each inhale and the length of each exhale, that's going to help slow that breathing rate and help tap into more of our rest and digest nervous system. Let's take 2 more deep breaths. Inhaling, ribs expand outward. And exhale, hands come closer together, body sinks more into the floor. One more time, inhaling, hands gently come apart as the rib cage expands. And exhale, body sinks further toward the ground. Next, let's lay your hands out like a T or your arms out like a T. Bring your feet wider than shoulder width apart. And we're going to go into windshield wipers for our hips. So I want you to think about your pelvis staying flat on the ground. If you feel your SI joints or your pelvis on the back sitting nice and even into the floor, I want that to stay the same throughout this movement. So we're going to start to drop our knees to the left. As you do so, you're going to feel your low back want to rotate up off of the ground. I want you to gently engage your core to keep your back flat and only rotate your knees as far as you can before that hip wants to start coming off the mat too. And then we'll wiggle our feet around, knees come over to the other side. Same thing, core lightly engages to keep the pelvis nice and flat. You can bring your hands to your hips if that helps for feedback. Then you can bring them back out because this position is kind of a nice chest opener. And back to the left. We don't need to necessarily integrate your breathing here, but just make sure that you are breathing as your knees come back over to the right. And one more, knees sweeping over to the left. Gentle core engagement comes on as you reach the end point so that we isolate this rotation at our hips, not so much at our low back. And then one more time, sweeping over to the right. Keep breathing, keep softening your rib cage into the floor as your knees rotate over to the other side. Coming back to center, I would like to bring our knees and feet together. And now we're going to let that low back come along for the ride. So your knees will start to drop to the left. Your hips and your low back will rotate up off the ground as far as you feel comfortable going. If that's all the way over to the floor, great. If that's at a 45-degree angle up in the air, that's great. Whatever your body is comfortable with today. And we're going to pause there. Then your right arm is going to reach up toward the ceiling. Inhale. Exhale, arm comes back to the floor. As your arm comes back to the floor, also think of your knees deepening into the stretch toward the floor on the opposite side. Inhale, arm comes up to the ceiling. Exhale, arm comes down to the floor, knees sink a little bit further. One more time. Arm comes up to the ceiling, inhale. Exhale, arm drops, knees sink a little bit further. Then drawing your belly button in, curling from your abdominals, bring your knees back to center and over to the other side. Inhale, lift your left arm up to the ceiling. Exhale, let it drop toward the floor. Let your knees sink a little bit further in a range that's comfortable for you. Arm comes up to the ceiling. Inhale. Exhale, let the knees sink further. Let the arm sink down. Last one. Inhale, arm comes up. Exhale, arms comes back to the floor. Knees sink a little further. Engaging the abdominals, draw your belly button in to pull your knees back to center. And then to kind of reset things at midline, let's hug your knees gently together for a hold of 5, 4, 3, 2, 1. And then arms down by your side and shoulder bridge up, driving through your heels, squeezing the glutes, pressing through the arms to broaden through your chest for 5, 4, 3, 2, 1, and lowering back down. Lastly, straighten out your left leg. Bring your right thigh toward you, and let's reach around the thigh, kind of curling around the hamstrings with our hands to hold on. We're going to end here with a nerve glide. So start by pointing your toes, ballerina style, point them away from you. Start to straighten your knee up until you feel gentle but comfortable tension in the back of the knee or back of the leg, wherever you feel it. At that point, flip the toes, drawing them toward you, which will intensify the stretch and come on out of it. So we're not holding, we're gliding. So we'll point the toe, straighten the knee, flex the foot, and bend. Point the toe, straighten the knee, flex the foot, and bend. 2 more. Point, straighten, flex, and bend. Point, straighten, flex, and bend. And switching legs, right leg comes out, left leg comes in toward you, holding behind the thigh. Point the toe ballerina style away from you. Straighten the knee up to the ceiling. When you reach gentle tension, flip the foot, flexing it toward you as you glide it back down. Point the toe at the bottom, straightening the knee up, flex the foot, and glide back down. Point, straighten, flex, and bend. You might notice we're going to do 2 more, that one side is more flexible than the other. You're just going to go with your comfort level of where that muscle is today. Last one. Point, straighten, flex, and bend. And then let's give your knees a little hug in toward your chest. If you want to roll side to side, let's take 2 deep breaths here. Inhaling 1 more time and exhaling back to rest. And that is our first restorative flow lying on your back.